My name is Emily Rich, and I'm an occupational therapist just 2 hours south of here in Tucson, Arizona. And I'm so excited to get to talk to you today for a short time about the many things we can do with autonomic dysfunction. Oh, I have to do the slides. I'm so sorry. All right, I'll stand over here since people have been having trouble with the slides. I have nothing to disclose. I will be talking about several different products in this lecture, none of which I have any association with, just think there's a lot of great stuff out there. As I mentioned, I work in the clinic as an occupational therapist, helping people mostly with Ehlers-Danlos and POTS, or forms of autonomic dysfunction. I'm also a Ph.D. student. So this will be quick and fast. Hopefully I won't talk too fast, but want to get as much information into your hands as possible. So in the right corner of these slides, you'll see these TLDRs, which stands for too long, didn't read. That's for folks, especially with some cognitive, like brain fog, but also just knowing that there's a lot of information at this conference. So you can reference those, and there'll be brief summaries of each slide. So if I'm going to talk about the autonomic dysfunction, I need to talk about the autonomic nervous system. I think most of you have heard of this system before, but briefly we'll talk about two branches and really simplify it as much as we can. So we've got on the left here this sympathetic or fight or flight nervous system, and then we have our parasympathetic or rest and digest or feed and breed system. And so you can see here just a few of the organ systems that the autonomic nervous system affects. It affects pretty much our whole body. And so the first one, starting with vision, when we're in that fight or flight state, which is commonly happening more often in folks with autonomic dysfunction, our pupils open up large. We're focusing on scanning for any threat, so really that peripheral vision. And we might have dry eyes, less of those secretions. You'll see on the right-hand side, it's just going to be the opposite for each of these. So I'll talk about the sympathetic state. We stop salivating as much. Our heart rate increases, trying to get that blood pumping so that we can run from the theoretical lion or tiger that's chasing us. We have faster, more shallow breathing typically, and it halts our digestion or our internal organ functioning. We hold on to our urine or feces, because why would we worry about that when we're running from a lion? And it closes off or constricts our blood vessels, shunting all of the blood to our core to protect what's really important for survival. So on this next slide here, we'll see some of the symptoms that might result from being in that fight or flight state more often. This doesn't mean that people just have anxiety and they're just anxious all the time, but when the body is stuck in that state more often, we might see light sensitivity from those pupils being large, difficulty seeing things close up because we're focused on that threat out here, and dry eyes. We might also see dry mouth, which is the first step to digesting our food with that chemical breakdown, so that leads to more poor digestion. And that heart rate increase might lead to feeling more anxious. Not that it's necessarily anxiety-driven, but when your heart races, makes sense. More shallow breathing, as I mentioned. Gastrointestinal symptoms are almost universal. Differences in bladder and bowel control, like feeling this urinary urgency, I have to go to the bathroom right now, and more often. And then cold hands and cold feet. You might also see some color changes, like that Raynaud's phenomenon, but that again is that blood coming to our core. So we have lots of lifestyle interventions that we talk about in different forms of dysautonomia or autonomic dysfunction. I'm going to speak to some of them today, but want to be sure to recognize this is so individualized. And so you really need to work with a provider, your medical provider, or finding someone on your care team to direct these specifically for you. But for most folks, we like to increase salt and fluid. Why salt, right? Salt is a horrible thing we've always been told not to have very much of. But a lot of times when people with autonomic dysfunction stand up, the blood starts to pool in their lower body. And so we might need some more blood circulating throughout the body to decrease the symptoms that are happening. And so if we add fluid, by itself, we will just urinate it. But if we add salt, those two together increase the amount of blood in our body, decreasing symptoms. That's not just the case for the low blood volume form of autonomic dysfunction. It's true for all of the forms of POTS. Sodium recommendations and fluid recommendations vary greatly. I live in the desert, so I'm going to tell people to drink a lot more fluid and probably have a lot more salt than someone in a very humid area. And it also depends on body sizes, which vary dramatically. But typically, looking at some kind of supplementation with your dietary, so in your food, as well as maybe adding some salt tablets. I give an example here of Vitassium salt sticks. Those are sodium chloride plus potassium, often better tolerated on the gut, but there's lots of products on the market. Also adding in electrolyte drinks, so powders you can add to your drinks or purchasing drinks. And I usually tell people, look for something with 500 milligrams of sodium or more, if it's palatable to you. A Gatorade, a Powerade, doesn't have very much sodium in it, but looking at some other products on the market, 500 is a good price to start. Compression is another lifestyle change that we recommend. And the goal here is that you don't have to think about it. You put compression on your body, it just helps to pump the blood up so that that blood pooling isn't as significant. Again, those blood vessels might open up more, and that results, they don't constrict as well and pump the blood for us. 20 to 30 milligrams of mercury is a good gauge, and up from there. If you can tolerate 30 to 40, go for it. The biggest challenge is getting them on and off, as I think most people in this room have. They've tried compression, it's not easy, especially with hypermobile fingers, right? So if you look here at the bottom, there's lots of different options for devices. Donning devices, it just means putting them on, and doffing devices means taking them off, just fancy OT lingo for that. So those options can be really, really helpful, and again, working with an individual provider like an occupational therapist might be helpful. The minimum, we would say, is to wear socks, like knee-high socks. Those help a little bit. Even better would be to wear full-length, waist-high leggings, not just Victoria's Secret leggings, but compression leggings. And then even better is to add an abdominal binder as well as the leggings. So there's a study showing that that can decrease the heart rate significantly. And so there's an abdominal binder on the far right picture that you'll see, but there's lots of options out there. This one wraps and wraps and wraps around, which I think is helpful for different body types, but lots of options out there. Positioning. So as I mentioned, going to upright, often challenging for people, right? So sit back down, right, if we can. Not always the case. Our world requires being upright a lot, but sitting saves at least 25% of the energy to do a task and helps with that orthostatic intolerance. Here's a variety of activities you might consider doing sitting down. Also, limiting your arm up overhead, for example, blow drying your hair, reaching in cabinets in your kitchen. Those things tend to require gravity, require effort against gravity for that blood draining from your arm, and it's just more exhausting. So trying to keep things at surface level, right at waist level or height. Limiting your time spent laying down. Well, that's the opposite of what I just told you, right? Not really. So sitting down is different than laying down. A lot of folks feel the need to rest and to relax during the day, which makes sense, but we just don't want to stay in that position for prolonged periods of time. So as much as possible, alternating. If I'm upright, sitting, elevating my legs if I need to, reclining, using a zero gravity chair, for example, or recliner. And then if you need to lay down, but try not to make that for long periods of time. Over time, it just gets more difficult for the body to tolerate upright. And so it's this balance of I'm having symptoms, I need to lay down, get back to closer to baseline, come back up again. And then I like to talk about taking 3 to 5 good, slow breaths before coming to upright or standing position. So we're kind of asking a lot of the body when we just pop right up, right? And so if we can start with getting that blood flowing, that circulation going, and then come to that upright position, we're kind of giving the body a little more opportunity to rise to the challenge. I'm not going to go through these specifically, but these are called counter-pressure maneuvers. They're strategies for getting that blood activated and pumping those blood vessels, constricting. Compression is great, and this makes it even better. If you can't tolerate compression, focus on these even more. Great for in the airport when you're flying home, standing still, standing in the grocery store. So things like calf raises, glute squeezes, standing on one leg. So now my muscles are working really hard on this leg to pump that blood versus that 50-50 on 2 legs. Vagus nerve stimulation devices are a huge area of research that is kind of exploding in the last couple of years, which is exciting. They're still pretty expensive and not affordable for most patients. So my hope is that over time that's going to change and there's going to be a lot more affordable products on the market. But what is your vagus nerve and why does it matter? Well, your vagus nerve is what helps to stimulate that rest and digest, or parasympathetic nervous system state. So if you can tone that nerve or strengthen its abilities and access to it, one, it will help you to go into that rest and digest state more often, and two, it will help you go into that state more quickly, so it becomes more accessible to you. It's great if you can do some breathing, mindfulness throughout the day, but really when we need this is when there's a challenge, when you don't really have the ability to say, I'm just gonna relax and just chill. It's like, let me rely on this nerve and what it's able to help translate the body to do. If you can't access a vagus nerve stimulating device like most of us, here are a variety of techniques that you can try at home to strengthen that nerve's capability. So things like splashing cold water on your face, gargling, laughing, singing. Singing often makes people feel better, and they may not realize why, but this could be a piece of it. So humming and singing is a great one. Movement to whatever ability you can tolerate. Taking slow, deep breaths. Massaging in different areas. You can look up some more resources on this or see a professional. And then, yeah, there's just some more ideas here that you can look through. Temperature regulation is often very challenging. So we are here in Arizona in August. Welcome to my life. I think sometimes I have so many patients because their symptoms are worse in the desert, but remains to be told. So the point is, temperature regulation, either extreme, typically is challenging for people with autonomic dysfunction. Our autonomic nervous system regulates our temperature. It regulates sweat and circulation, all of those kinds of things. So, there's lots of different tools that we can use to compensate, like cooling devices, cooling towels, personal fans. You'll see in the bottom right picture here, there's a fan that a lot of my patients love. It's pretty quiet. Put it around your neck. I think it looks like headphones, and it just blows. You can pick different speeds for it. So there's more and more products all the time coming out, as well as, of course, using a mister, carrying around a personal fan, a cheap one from the drugstore, cooling patches, lots of things in that way. And conversely, the cold. So those of us who are in a different part of the country where it's cold right now, it's hard to imagine, but using things like hot packs and hot hands, dressing in layers, of course. I often have patients say, well, I feel like, I feel silly having to wear a jacket in a cool room. You will never see me in Arizona without a jacket because it's always over-refrigerated indoors. And so rather than letting your body get to that, I'm really cold, like I can't take it anymore, prepare ahead as best as you can and try and keep your body regulated. You're not going to win any awards by seeing how much you can tolerate the cold. Some people will get chills and they really can't recover. And so just try not to let yourself get to that place. Biofeedback, I could talk about this forever, but it's the idea of your biology or your body and feedback about it. So just awareness of what's happening inside. It's kind of like if you were to take an x-ray or be able to see through your skin. What's actually happening on the inside of my body? Lots of different forms that this comes in. one of them being heart rate variability, and I think that's not a video. But this is a screenshot of what it looks like to do heart rate variability training, and basically you just wear a little sensor. You're working on breathing, and we're seeing how your heart rate and your breathing are kind of matching up. You know, if you're breathing more shallow. At rest, that's great. But then what happens when, for a lot of my Gen Z patients right now, like you have to make a phone call, you know, to a doctor's office. You know, your heart rate might go up. Your breathing's probably going to change as well. What can we do about that in the moment? Temperature regulation, so putting a sensor on your fingers or your feet and seeing, my hands are really cold, but this is not a cold room. That might mean that I'm more in that fight or flight state, working on regulating your temperature. Muscle tension, if you're holding a lot of stress, for example, in your shoulders, like most of us do, trying to learn, you know, how can I relax there? Is there another place in my body that I'm holding that tension? Sweat responses, and then brain waves, EEG. You should be able to find someone near you, depending on how remote you live, who specializes in biofeedback, whether it's an occupational therapist, a physical therapist, neuropsychologist, lots of professionals use this technology. If you don't have access to somebody, there are 3 apps, well, 2 apps and 1 device that I've listed here. I have no affiliation to any of these companies. I just think it's really great that patients now have access to this. The Juva Health specifically is created for migraines and free. So it's a really good resource. It uses your phone camera, and I think it's only available for Apple products right now, unfortunately. Maybe one day. Another lifestyle intervention that we use for autonomic dysfunction is actually changing the angle of your bed. Patients look at me like I'm crazy, you know, thinking they're going to sleep at a slant. It's only 4 to 6 inches at the head of the bed. I'm not telling you to elevate your head or your upper body. I'm actually telling you to change the angle of your whole body. So whether you use a full body wedge or you actually prop your bed up with, you know, cinder blocks or bricks. Yeah, what's happening here basically is you're not getting rid of as much of your blood volume overnight. So most people, when they wake up or in the middle of the night, they have to urinate. This basically starts your day off with a little bit more blood volume in your body. It also helps your body get used to this position. So usually people say, that's opposite, right? My feet are supposed to go up. You're not telling me to put my feet down. I actually am. And so, you know, symptom management, elevate your feet as needed. But if you can tolerate it throughout the night, this slight angle helps those blood vessels in the tone of your legs to get a little more used to that upright position. Adapting and modifying, this is the bread and butter of what occupational therapy is. It's all about compensating, finding ways around what's going on. Unfortunately, I don't really have a cure for autonomic dysfunction. Fortunately, we can manage symptoms. Even if you don't have a cure, you know, I actually have POTS myself, and I'm standing up here for a pretty long period of time and able to tolerate quite a few things that I could not tolerate early on in my journey. It's not the case for everybody, but there's a big spectrum of function when it comes to these kinds of conditions. And so I think, you know, creativity is key. Finding someone, even if they don't know about autonomic dysfunction, someone who's willing to learn, who's willing to find resources for you and brainstorm. You know, occupational therapists are trained to work with people with chronic conditions, and there's a lot of different resources that we have that people might not know about that can definitely apply to autonomic dysfunction. Movement might be one of the most important and maybe one of the most controversial with patients, but it's really important that I mention it. Seeing a physical therapist or an occupational therapist, I'm definitely going to recommend. I know that a lot of folks have done really well with exercise, and I know there's a lot of folks that have really not done well with exercise. And so my message is there's potential for exercise, I think, or movement for everyone. It's really finding what that looks like for you. We talk about with Ehlers-Danlos and hypermobility, motion is lotion. You know, there's these extremes of not moving at all. Often the joints feel more stiff, have more pain, like at bed at night. And then there's the extreme of doing too much, right? And then people have pain as well. But what is that in between? And finding the right amount of movement, the right type of movement there's a few examples here, can be really huge. Swimming is a great option, especially this time of year, but also indoor pools year-round. For autonomic dysfunction, it actually helps to provide compression. So you get in the pool, and it's basically like you've got a compression garment on, way stronger than anything you're going to be able to put on with your muscle strength. So the deeper you go into the pool, the more compression there is, and a lot of folks feel a lot better just getting into the pool. And then I also like always to recommend, your daily activities. You are moving and you are doing things in daily activities, and so, using those as opportunities as well. Sensory regulation is huge in autonomic dysfunction and also in Ehlers-Danlos syndromes. We don't want to tell someone to completely avoid sensory stimulation. That usually results in you feeling worse. So if I can't go to the movie theater because it's too loud for me, I might tell you, or you might tell, anyway, if I have a patient who can, I might tell them, there are noise dimming earbuds that can help to decrease the volume of sound coming in. Those would be great to wear while you're in the movie theater. You can still go, it doesn't prevent you from going, rather than wearing earplugs that don't let in much sound at all and wearing them all the time. Typically, that's actually going to make people feel worse over time. It might manage your symptoms in the immediate, but it might make you feel worse long term. So using sensory regulation as needed. If you have a headache, if you're feeling some symptoms coming on, use those tools and then remove them as you feel better. Weighted items are a great example of that. The weighted lap pad here in the photo. A lot of people don't like weighted blankets, so I think these are a good alternative. They provide proprioceptive feedback, which often helps with grounding, can help with dizziness, and lots of different things. All about finding balance. All right, take-home message. This conference has already had so much information, and we still have more to come through today. So something to consider is to think about 2 take-home messages from each lecture, or the lectures that you're interested in. It could be something that you learned that was new, 2 take-home messages that you want to think about or explore, rather than taking notes on everything. What we know is that people are more likely to follow through on things and more likely to remember things if they have less to focus on. You can find me at any of these social media outlets. Instagram, I'm on the most, and happy to answer questions as I can out in the world, but we will also have a Q&A panel in just a bit. So thanks for having me here today, and thank you to the Society for inviting me. And until next time, thanks.